AB, you have some reporting on something near and dear to your heart, and that is how cruel this virus has been to our veterans and military. And as a secondary question, I would ask you how our veterans and active duty military have fared under this commander-in-chief in the COVID-19 era.
Brian, the situation both in the VA health system for 9 million veterans, half of whom are over the age of 65, with underlying conditions for many of them, either related to their age or their service, in these poorly run facilities, tight spaces, cared for. We have learned finally from the VA, they've admitted they've been rationing personal protective equipment, not enough masks and gowns, getting sick themselves. 10 have died among staff. Soldiers Home in Holyoke, Massachusetts has now lost 73. Another facility in New Orleans, 53. Veterans are in real peril because of a lack of preparation, and then the same dysfunction and denial and dismissal of this virus that the general population has seen. We saw on the USS Theodore Roosevelt the beginning of how this virus is going to put, in the same delayed response, our active duty troops in harm's way from the spread of the virus. So now 4 aircraft carriers see positive cases. Training recruits are in tight spaces trying to train up to be put into the pipeline using social distancing and trying to avoid the spread. The Navy submarines are very vulnerable. And now, since my piece was published, the president is demanding 1,000 cadets return to West Point so that he could speak to them for a graduation that they really shouldn't be gathering for, getting on airplanes for. It's just been a remarkable betrayal of our troops and our military readiness and our veterans who've given everything for us and are losing their lives in great, great numbers.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.